So here's a good question. And this person asked, when would you start to think about medical issues with a horse as opposed to behavioral issues? All the time, okay? But it's not going to negate addressing the behavioral issues. And so one of the things, whenever we get a horse in for training at Steady Horse, one of the first things we do is we take them to our vet. We also take them to our person who does body work, and they go through that horse with a fine-tooth comb to see if there's maybe something that might be affecting that horse one way or the other, because that's always something that we want to be mindful of when we are working with a horse. We want to make sure that the horse is comfortable and feeling good. As a preventative measure, I put all of my horses on a supplement called Equine Vital Rose Hips, which is absolutely incredible. It helps with inflammation and joint health. And so it just, again, it gives me the peace of mind of knowing that when I'm working these horses and when I'm working a horse, they work quite a bit. I want to make sure they are as comfortable as possible. So always rule out that there's something physical happening. Now, that being said, even if there is something physical happening, a lot of times horses who have a physical issue might develop an habitual response to that issue. So even once that physical issue is resolved, they're still doing that response of kicking out, bucking, biting, whatever the case might be. And so even if there's an issue going on, work with your veterinarian, your chiropractor, your bodywork person, your massage person, whoever, to see, okay, what kind of work can I do that this horse can comfortably do so that I can work them through these behaviors. And all of the Steady Horse principles and exercises and things that we teach are gonna help you tremendously there so that when that horse is feeling better, they've already developed a habit of responding with you, connecting with you, and paying attention to you. Now, some people might call me a monster because of this, but I am a big believer of when my horse is uncomfortable. Now, obviously, if I have like a severe grade of lameness or something with a horse, I'm not gonna work them. But if my horse is just a little bit slightly off or a little bit uncomfortable or irritable or something going on, as a trainer, I try to work my horse through some of that stuff. I wanna be aware of it, but I wanna work them past that discomfort, because not every person, especially my clients, they're not going to necessarily see the things that I see. And so they might hop on that horse who's maybe a little bit oochie or ouchy. And so I want to teach that horse, like, okay, you might be uncomfortable, but don't lose your mind. Don't go into a bucking fit. Keep your client, keep your person safe.